Here from Complete Care Animal Hospital. So I wanted to talk a little bit today about food allergies, what's real, what's perceived. We hear a lot of hype with many companies as far as their creative advertising about talking about that their products don't contain corn or they're gluten-free. So we just wanted to talk about a little bit of those things because we get a lot of questions from owners who are just unsure of what the correct answer is. There are patients that do truly have food allergies, and when we talk about food allergies, the 5 common things that dogs and cats are most allergic to are chicken, beef, corn, wheat, and soy. So those are the 5 big ones. And so again, you heard corn was on that list, but we also heard chicken, beef, soy, and wheat. And so when we pick a novel protein food or a food for our allergic pet, it needs to not contain any of those 5 things or any derivatives of those 5 things. Corn, which has taken a big hit in the media, and there's a lot of creative advertising campaigns out there with many dog food and cat food manufacturers. So a lot of manufacturers are insinuating that corn is bad for you or bad for your pet by saying it's corn-free or grain-free. Corn, there is nothing wrong with corn. Corn is an excellent protein source, and for patients that are not food allergic, there's no reason that they cannot have corn. A question I get a lot of times is, can we test them to see if they're allergic to certain foods? There are allergy tests for food specifically, but we do not recommend that they're utilized because there is a very false positive and a false negative rate. So the best thing that we can do is do a diet trial. A diet trial is 8 to 12 weeks minimum before we're going to see results. And it's not like we switch from one brand of food to another. We need to, again, switch to a completely novel protein, novel carbohydrate. The things that we recommend for canines or for our dog patients is often a venison and potato-based food, a pork and squash, venison and lentils, and part of it is what your preference is and what your pet's preference is. There's lots out there. We don't generally recommend any duck-based foods because, again, you heard me say that chicken is one of the big allergens that we worry about. Duck is very closely related to that, and for some of our allergy patients, that's going to be too close for them to have a reaction. So we're going to pick a food, hopefully with the guidance of your veterinarian, whether it's over-the-counter prescription, and we need to completely switch your pet over to that, again, for 8 to 12 weeks. We can't forget about the extras that they get on a daily basis. So there are treats like Muddy Paws and Grumps. These are just pieces of dehydrated sweet potato. These are great for our allergy patients. These are fruitables. These are awesome. These are a pumpkin and cranberry flavored treat, and it's important that you flip the ingredients over and you look. Pumpkin, oatmeal, barley, potatoes, oats, sunflower, cranberry, cinnamon. Nothing in here that's going to cause a reaction. If you look, this is the same exact company that makes another great treat. This is a pumpkin and mango flavored treat, but if you look at the ingredients and you read down here, there's gelatin. That's from a beef source, so this would not be an appropriate treat for a food allergic patient. We've got these Nylabone treats. They're great. Love them. If you flip the ingredient list over, though, you can see that there's chicken in here. So I would not do this for a food allergic patient. What would we use instead? Deer antlers, especially if your pet is on a venison and potato-based food. These make great chew toys for our food allergy patients. I think it's important to remember all of this because if you're trying to do a diet trial at home, these are the little things that people sometimes miss. Something that other times people don't remember are what else is going into their pet's mouth as far as heartworm preventions, flea and tick preventions, toothpaste, things like, antibiotics that your pet may need. These are in gelatin capsules. So if we have a patient that is sensitive to beef, we need to take the medicine out of the capsule before we administer it because this may cause a reaction in your pet. Same thing with toothpaste. Brushing our pet's teeth is so very important. We have a chicken flavored product and we have a malt flavored product. If I have a food allergy pet, I'm going to skip the chicken and go for the malt. So I think it's the big important thing here is to remember that everything that goes in your pet's mouth is important. So if your pet is on a venison and potato-based food, if it's not a potato or it's not venison, it probably shouldn't go in their mouth. I don't want to leave our feline friends out because cats have food allergies as well. So we have a potato and rabbit-based food for them. Same thing, you have to cut out their treats. They can't get any of the extra stuff and still be on their diet. So I know that this can be confusing. I hope this kind of clarifies things a little bit for people. The best advice I have is to pay attention. Everything that goes in their mouth should be related to their diet. No table scraps, no over-the-counter biscuits, no vitamins and minerals that are flavored. Make sure you run everything through your veterinarian, and remember, it takes 8 to 12 weeks when switching your pet's diet to really know if we're going to get the results that we want.